Well, today was a really important day where we brought together people from across our health and care system to learn about what's been happening with stewardship to date and to plan what's going to happen in the future. And we've had a great morning.
As you can hear, the room is full of a range of professionals and people from the front line, patients, clinical leaders and other stakeholders who've come together around a common goal of delivering improved services and integrated care to our population. It's been a fabulous day.
Today, for the first time in ages, we've brought together all of our stewards together around a single challenge. Where do we go next with our integrated care system? And it's been so exciting having all of them together with execs and non-execs and people from different organisations to come together to celebrate stewardship.
It's a really good opportunity to bringing together all of the existing stewardship groups and introducing us to new stewardship groups. And it's a really good opportunity to see what's been going on for the last couple of years. But also it's great for the newer stewardship groups to see where the older stewardship groups are in their journey and the kinds of things that they've done as well.
We've never done this event on this scale before, and today's absolutely fantastic to see so many various organisations, and it's really great because we've got new people that have come in that shine a slightly different lens on where we've been previously, and you can feel that buzz and the excitement and the energy in the room, so it's a great opportunity, and to do it face to face.
I think from an NHSE perspective, we're always interested in how systems are already working and how systems can work. I think what I've seen today is a fantastic example of some of those really core principles of system working as opposed to kind of more fractured approach that is probably more what we're used to doing historically. It shows a real change, and the energy in the room was fantastic in terms of the way people have really embraced a different way of doing things.
I've been blown away with the amount of fantastic partnership working and the real focus on improving care of patients. I would say the biggest takeaway for me is making sure that our organisation, each of our hospital sites and our teams have the time and space to help to contribute to the work across the county in improving care for patients.
Healthwatch Southend is the local voice of people who use health and care services, and we're really keen to work with stewards in the future to really amplify the patient voice. We've heard some good examples this morning, but I think there's a lot more that we could do to bring patients in and to bring their lived experience to bear and influence the changes that we want to make together. It's really important to think about how we bring their experience and the outcomes that they have to sit alongside some of the financial discussions that need to take place in the stewardship group, so that we're actually improving outcomes and making good use of resources at the same time. And rather than reinventing the wheel, we need to learn and share from what's working and actually get that out into local communities. And this is a really good opportunity to do that.
I think people have recognised that stewardship is not a little niche event, that stewardship is something that crosses our entire system and needs to have collaboration across the system. And I think people now can see the real potential of stewardship for Mid and South Essex.
Stewardship has its roots in values and approaches that the NHS has had since its inception. From my standpoint, it's really good to see that this is something that's going to continue. It's coming towards the end of my time in this system, but I leave it in good hands, and I can be absolutely confident that the work that's begun is going to continue.
From the beginning to end, we've had so much energy and enthusiasm. The fact that even though our world is changing, we've got new leaders coming into our system, dedication to stewardship and the values that it entails remains steadfast. And I think hopefully people will see that from the reactions and presentations from our leaders today.
It's great to be here, and it's great to be here primarily because of what I've learned in the last hour. And indeed, while I've been listening to you, I have been busily emailing our ICS network and our external affairs team saying we must showcase the fantastic work that you're doing, because it is exemplary, patient-focused, cross-system working. It's fantastic to watch. So, even if the tech broke down now, you couldn't get a word from me, I would have gained a lot from listening in.
We've had the opportunity to celebrate some of its successes, but we've also had the opportunity to share ideas for what happens next. And certainly I know I've taken some ideas away about how we improve the way in which we're managing resource across the system. So it's been a really great morning.
I think the key message is to capitalise on this enthusiasm and this moment of hope, actually. I think if we learn from each other and actually realise there is a way out of things that seem really hard, but it might be a slightly different way to what we've done things, but actually to put our faith behind that and really join together in that effort, I think that's the key message. And I think it's fantastic that here in Mid and South Essex we are taking this different approach, because it is going to be the right approach, and I think everybody, we're all stewards, all of us.
I think in a system like ours where you've got people working across, several different sectors, 15 different organisations, days like this is a really useful chance to come together so that everybody's got visibility of the huge amount of stuff that we're all doing in our different care areas. I think given the energy of today, all the stuff that we've heard about in the sessions, I'm really looking forward to coming back in 1 year's time to hear about all the work that 10 groups now will have done over the next 12 months.